Myself, hello everyone. So, like I said, I'm going to quickly introduce myself and then just take questions for the rest of this day. I'm going to talk a little bit about the journey that I've been on and why I think patient advocacy is so important and why I think patients like myself need to have a bigger seat at, or more of a say in some of the decisions that get made in the neurotech space in particular. Feel free to ask any questions that come up along the way. So the journey I've been on, well, began really when I was born in Kenya. I was a little baby. Um, and I actually went back to Kenya. This is almost exactly 10 years ago today. I would get diagnosed with Parkinson's basically 3 months after this picture was taken. Um, but yeah, a lot happened along the way between those two pictures, as you might be able to tell. But that was basically who I was at the time. So I was living and working in China. I was working for this big education company out there when I got the bad news that I had Parkinson's on a trip back home to Toronto. Now, I then went around the world and I thought about what could I actually do about this disease? How could I maybe help myself and others like me in the situation that I was in? And so I started to give talks all around the world. This was actually taken from one of the first talks I gave at McGill. The title was it was all about tackling Parkinson's disease. It was a 4 hour long lecture on Parkinson's and everything that I kind of thought about the field. It culminated though about 2 years ago when I got this new adaptive deep brain stimulator implanted deep inside of me. And so I'm also going to show some pictures that might make you a bit squeamish. So if anybody's a bit squeamish, you can turn aside. But if not, then have a look. So that's the first one. There'll be others that are more brutal, but that was one of the pictures I took after I got the surgery. That was actually right after I got my surgery done. I was like, I think the second day after I got back home from the surgery, you can see I still have the band-aid on my head. That scar, which is right there on my chest. It's healed pretty nicely though since, but this is 2 years ago today, or almost 2 years ago exactly today as well. However, I realized along the way on this journey that I've been on, there's a lot of problems in biomedical science and in this field as a whole. One of the biggest problems is that we don't know how to distinguish between individuals and populations of people. I'm going to do something now that you probably shouldn't do in your talks if you're going to give any, but I'm going to quote myself from Brain Fables, which is a book I wrote with Alberto Espe. And here I say, everything we know about this disease comes from studies into groups of people. Those people get plotted as dots on a graph. A line then gets drawn through the middle of the group, reflecting the group's average. That average becomes a result of the study. An average that almost none of the dots falls on. It's a big problem that we don't really have any good solutions for this problem yet either. Just to kind of illustrate that problem a little bit, here's a quick little graph you can look over. That's basically how medical science works. These groups of people that get plotted on graphs like this, and a line gets drawn through the middle of that, but none of the people actually fall that nicely on this line. So I think a big challenge for us going forward is figuring out how can we actually get more, how can we get down to the individual basis? How can we actually think about applying therapies to individuals rather than to populations of people? The other big problem is access to care. Uh, I could talk a lot about this, but there's a picture that sums it up better than I ever could. So I'm just going to let this picture talk for itself. So essentially, I get about 20 or 30, or most patients, I get about 20 or 30 minutes every month with their neurologists. Every year, every 6 months with their neurologist, they get about 30 minutes of time. That's not nearly enough time to tackle all the complications that result from these kinds of difficult to manage diseases like Parkinson's. Now, I was diagnosed 10 years ago, like I said before. I did what anyone would really do. I went on the internet and I started to look for other stories or things that I could glean from the internet. I found a lot of pictures like these ones. Now, I don't know what you guys think, but I don't think this man really represents anything that I experienced or what I'm going through. And so I continued to search. I continued to think through my memory bank as well. I remembered this guy, Muhammad Ali, at the Winter Games or at the Summer Games in Atlanta, Georgia. This is in 1996. Now, something else that became very apparent to me afterwards was that one, he has a frozen expression on his face, And two, you can see his hand. His hand is like almost like a claw, kind of. That's called dystonia. But what that's emblematic of is that I know that that's also happening probably down in his feet. So his toes are probably curled up like that as well. It's a very painful thing to experience, very painful thing to go through. And I mean, a lot of people probably look at this picture as like this great man who's accomplishing these great things. But I remember thinking back and looking at this picture and thinking this is the future that I was doomed to live. I thought that by now, basically, 10 years past into my disease diagnosis, I thought this was going to be my future. But it hasn't been, thankfully, because of DBS and because of this new adaptive kind of deep brain simulation that I've recently, or that I've been going through for the past 2 years. Now, again, this next picture might make you a little bit squeamish. So if anybody doesn't like to see any of these gory details, you can look away right now. So that was taken during my surgery. I was awake for the entire thing. It was about an 8-hour procedure. And you can't see my eyes. I was wide awake for this whole thing. One of the cool kind of, or not cool, but so one thing that this surgery might do for a lot of people is it induces trauma in some. And really, it's the drilling of the boreholes. It's most traumatic. Drilling of the holes through the skull. That's the part that really gets to a lot of people because for me, it was the first time in my life where I ever heard sound coming from the inside of my head out rather than the other way, which is, you hear everything, it comes through your ears, and then that's how sound is created. The first time I ever heard sound coming from the inside of my head out. It was an experience like nothing I've ever felt before. It was like no sensation I've ever had before, but it was the reality of what I had to deal with. Now, before my surgery, I think there's some questions about the other options that were available to me. These were essentially the four other kind of cards that I had to pick from. Gene therapy on the left, focus ultrasound, DBS, which I eventually picked, and cell replacement therapies. In the end, I chose DBS because of one kind of simple reason, and that was the amount of clinical experience that this field has with DBS. This procedure has been done over 200,000 times all around the world, and so there's a lot of like collective experience that we can lean on if we're ever going to, so that patients like myself can make these better decisions. But these other techniques that are slowly coming online, especially cell replacement therapy, some exciting new things happening there as well. They're not quite ready yet for the mainstream, I think, but they might be a better option for some individuals with certain brain diseases like what I had. All right. So coming back to the day of the surgery, though, so that was me the day of. Um, I was about to. So I remember there was an emergency case actually that came into the office that morning of. So I had to sit there in the office after they put on that frame and they bore the thing into my skull. I had to sit there for 2 hours, and it was right after COVID, so the emergency room was very cramped at the time. I remember looking into the eyes of the other patients that were there as well. They all looked kind of horrified to even look at me, thinking like, "What the hell is this kid about to go through?" But yeah, that was me on that day. This is me waking up in the hospital after they implanted the battery in my chest and they tunneled the wires through my neck. As you can see, I was not in a very good mood, um, but it was important for me to have to actually deal with that. But in the future, I'm hoping there's something that some of you might be a part of as well. Is that these new DBS devices? I've seen some of them; they look really cool, but they'll all be in the cap, so that all we have to do is then just drill the holes and then you're basically done. Because the wiring through the neck and the insertion of the battery, that was by far the most painful part. That's why this procedure takes so long to recover from as well. It took me about 3 months before I was actually able to get up and like be kind of more or less normal again. So yeah, I'm grateful that soon, hopefully, people won't have to go through that part anymore. The very important thing is I have a great relationship with my neurologist. He's also my DBS programmer. Programming itself it's a very difficult science. It's not really a science, it's more of an art because there's basically 4 different contact points at the end of each electrode, and each contact point can be tweaked in so many different ways because there's 3 properties to electricity: is the shape of the wave, the amplitude, and the voltage, or the frequency, not the voltage. each of those three parameters can essentially be tweaked in almost an infinite number of ways. And getting each patient to the point where the doctor can confidently say that they're on the best or they're optimized for their care. It's a very difficult thing for them to do. It takes a lot of time, a lot of patience, and frankly, a lot of doctors and patients don't have enough time to actually run through all of the different possibilities and see what happens each time. Also, because as one's disease progresses, they need some tweaks to their settings. And so it's just a very difficult part of this whole process that we haven't really done a better job of quite yet. There's so many patients that are out in the world that I've met who aren't properly optimized, who could be doing much better than they are today, if not for the fact that their neurologist or their DBS program just doesn't have enough time properly to care for them. And then the last part of my kind of care team is my family. That's my mom, my uncle, my dad. Without them, I definitely would not have been here and definitely would not have gone through everything I've been through. And yeah, I relied on a lot on them for physical and emotional support at many different times along the way. I'm going to show you now a quick video of what it was like during the first programming session as well. I don't know if you can hear this though. Can you hear? If not, then I'll just quickly go to the good part. Show you. So here, so there, so here I have like very pronounced tremor. You'll see it go away the instant he actually presses on his little pad, because as I'm sure you know, electricity moves very quickly. You might also notice that I was much skinnier back then as well. I was down like almost 145 pounds. I'm now almost over 200 once again, which is byproduct of DBS, but also because of some other bad things I've done. But I'm happy to talk about those if you have any questions in that regard as well later on. All right. Now, so after I got my DBS surgery, I reached out to Brian Pepin, who's the CEO of Rune Labs. He then flew me out to San Francisco. I spent like a couple weeks with them, and I became like enamored with their team and with this new technology that they've now brought on, brought online for patients all around the world. And actually, this part on the left. So on the right, you see what the clinician will see, but on the left is what the patients actually see. And that's only been live for less than a month right now. That's because of the patient advisory board that I helped build for Rune Labs. So together we've helped more patients actually get to see their own data so that they can make better decisions for themselves. So as you can tell, we have an FDA clearance to track tremor and dyskinesia in patients. Those are two of the most prominent symptoms of Parkinson's. And this has really given life back to a lot of different people all around the world. It's also a very powerful clinical tool because clinicians can see any kind of changes that are needed, or if they change your therapy in any way, they can see if it's actually helping you or if it's not helping you. So there's only two symptoms right now. There's a lot of different symptoms of Parkinson's, but there are two of the most prominent ones, and this has been very helpful for me specifically. And for patients like me who are more tremor dominant, then this is a very good tool for them as well. Here's a quote that I'd like to kind of leave you guys with. Yeah, you can just read over that and take that for what it is. And the last slide is going to be a little more. So I've written now two books. The first one is called Brain Fables. I think some of you have read that before. I saw some questions about that. Happy to answer whatever questions you have. But actually, last week, me and so this is written with Alberto Espe. He's in Cincinnati. My neurologist name is Alfonso Vizano. And together we wrote this. So this one will be available later this year from Springer Publishing. And yeah, we hope that people will read it and buy it, and hopefully it will make the desired impact that we all hope to have on this field. And with that, I think I'll say thank you and happy to take any questions anyone might have.
Amazing. Thank you so much, Ben, for sharing your story and taking us along your journey. Absolutely incredible. And we have a lot of questions for you just about everything that you spoke of. So you hit a lot of really great points. I think the first one that we want to start out with is advice on creating your personal brand, and then we'll get a little bit more into specifics of treatment for Parkinson's disease. So this first one on creating your personal brand is from Sophia. Is Sophia on the call with us right now?
She couldn't make it, so if you just want to ask it on her behalf, that'd be great.
I'll ask this one on her behalf. So she asks you, as a consultant and research advocate, you've been very successful in taking something you care passionately about and constructing a very non-traditional and intentional career pathway for yourself. Could you give us advice on creating your own personal brand and succeeding at raising awareness about the things you care about?
Yeah, I'm happy to, but it was, I know it might seem like it all happened very quickly. It was very easy for me, but it took a long, long time. Like I said, I started out this journey. I was living, working in China at the time. I didn't know any researchers. I didn't know any of the doctors that I now know today. I didn't know any of the patient advocacy groups either. I've gotten to know almost all of them all around the world, but that was through a lot of traveling, a lot of like difficult moments I had to go through. I remember at the beginning, I would send like 10 emails out for every one that I got back. Now it's basically flipped, and I get about 10 emails per day that I can only really respond to about one out of 10 per day, per whatever the flow that I get in. Um, but the reason why that slipped is because I took a lot of time and energy, and I spent also a lot of money, of my own money, from money that I had in China. I made quite a bit of money out there. I was pretty fortunate, pretty lucky to like be in a position where I could, um, where I had some resources, and I could actually use them in ways that I thought was best for my own personal self. Um, but for those who might be interested in actually following my footsteps, one piece of advice I would give is you have to be stubborn and you have to have a thick skin if you're going to actually become an advocate. Because you have to be able, because at the beginning you're going to hear a lot of no, you're going to hear a lot of people like just shooing you away. You're going to have a lot of those moments where people do not respect you. And I still get that from time to time. I don't really, but it's important that you don't really like take it too personally and you don't really care that much, because the world is not meant to deal with your specific problem, whatever it might be. So make sure that you don't think of yourself as, don't inflate your ego beyond the point at which it is. Um, Make sure that you have a solid head on you, ground yourself in like a good space, good place as well, and take time for yourself as well. I mean, I took a lot of time to just read through all the articles that are out there. I did a lot of studying. I did a lot of research as well beforehand, before I actually went out into the field and started to meet everybody. But I did it all independently. So I would say if you're going to be go down this path, there's also no like programs for this. There's no school of advocacy that you can go to. There's no programs of that sort either. So you don't necessarily need to go back to school for this, but you do have to spend a lot of like independent time studying, getting to know the field, getting to know the people that are making the decisions in the field, and then you can maybe start reaching out to some of them. I was lucky enough to actually find those that were receptive to the message that I was giving out into the world. And that then helped me to actually get to where I am right now. But yeah, thank you for the question.
That's some great advice. Thank you for sharing. I want to speak a little bit to your point about all the time that goes into the research and kind of the mindset behind that. So Anushka had a question regarding some of the challenges you may have had in relation to when you were writing Brain Fables and just kind of handling a large amount of research. So I'll pass it off to Anushka to ask.
Yeah, I had a question about your writing process during creating Brain Fables, and maybe if there were specific challenges you faced or things that you learned in the process of synthesizing a large amount of research and material so that you could communicate effectively with people and really connect with people.
Well, a lot of it came from my blog as well, tomorrowedition.com. Some of the writing actually was taken directly from that blog and made into the book later on. And the new book as well. There's a lot of like my recent articles that you'll find some of them in there. There's a lot of new material though as well. And I don't know if I have a lot of advice though on how to actually like synthesize it all though, because you have to have the mind for it. You have to be willing to actually put in the time. Each book takes like it's been like the last book's been a 3-year process really. And we just like signed a publishing agreement last week, really. Wait, hold on. Sorry. But yeah, it takes a lot of time and effort, and there's no shortcuts either. You just have to be able to put in the work, and put in the time, and also align yourself with the right people along the way, people that are aligned with your mission and your goals. Similar to the last question as well in that regard. But yeah, thank you for the question. Very good question.
Thank you. That was awesome. And then just kind of also touching on your discussion of brain fables and handling the amount of research. Reem had a question about a specific topic that you covered within this book. So I'll pass it off to her.
I was just kind of reading some reviews, and some of the understanding is that this book kind of focuses on refocusing our understanding of living and aging. And I was wondering if you could go like more in depth about what that means, and specifically what that means for PD advancements.
Sure. So brain fables, a lot of it was inspired by the work of Alberto Espe, who spent decades really in the field, just honing his own thinking about how to actually tackle something like Parkinson's. And he basically reached the conclusion that, for one, Parkinson's doesn't really exist. I mean, there's nothing in nature that you can point to and say that's Parkinson's. Now, there are some people though that still claim otherwise. There's some big organizations that would even make that claim, that there is something called Parkinson's, and I've identified it, and I can tell you exactly what it is, and this person has it, this person does not have it, kind of thing. And it's still a debate that's still ongoing. I mean, and I have a feeling it's going to be going for a long, long time, because until there's like a definitive therapy that can come along and actually help individuals like myself so that they don't have to progress to the point where they need DBS, then yeah, we're going to continue to have this kind of scourge about us, and there's going to be these new fangled therapies that come online as well. I'm sure some of you have followed like some of the aducanumab scandals and some of the Aduhelm and what do they call it? The A beta blockers and A beta disaggregators as well that have come online recently. That's all intertwined in this whole convoluted story about protein aggregation, protein disaggregation as well. It's not an easy thing. There's no easy solutions yet, because there's still no therapies that work for patients. Until we have real therapies that are proven to work and that have been put into patients' hands and then they can take them, then we're going to continue to climb this mountain, continue to have these discussions, and continue to have these debates. And it's for the best. I mean, until we have a good answer, we're going to need people like Alberto to keep pushing the envelope and keep challenging other scientists and other doctors to think about their patients as individuals as well. Which come back to aging though. I mean, our brains are very complicated things. So that's kind of like an understatement, but is it that we're so incredibly complicated that there's so much complexity that we have to get comfortable dealing with as well. And personally, I don't see how any one chemical is going to actually just drop into this massive vat that is our brains and fix whatever's going wrong in all of these different people, because they all have different lives, they have different stories. And another big issue is the animal models that our therapies are tested on, they have to pass to get into people. None of them can recapitulate these disease processes. These things take decades to undo themselves, and all of our animal models die after a few years. That alone will make it very difficult for, I think, any one chemical to come along and actually fix everything that's going wrong in the brain of a person like myself. But yeah, I'm not sure if exactly that answered your question, but at least touch on some things.
That I think that answered the question. You spoke about climbing the mountain of like neuroscience research and Parkinson's disease research. And so I have a question a bit more on the specifics of that from Anna, if I can pass it off to Anna to ask that.
Yeah, so I guess there's two parts to my question, which are kind of related. But the first bit, I remember reading Brain Fables when it first came out, I think for a class in 2020. And I was wondering, kind of since then, from the experience you've had, like the research you've done, what you predict would be the next kind of significant advancement in Parkinson's treatment. And then sort of second part to the question would be kind of from a neuroethical perspective, sort of how do you what do you see as being important for us to manage when applying treatments like deep brain stimulation, especially looking at the personal identity, autonomy of patients using it.
Mm-hmm. Great questions. As far as like the next big breakthrough, I think it's going to be, I think it's a lot of what we talk about in Brain Fables, but I think it's going to be 1% of this population at a time. I think Parkinson's just doesn't exist. I think we're going to find that there's about 100 different, if not 1,000 different forms of Parkinson's, 1,000 different reasons why somebody's brain is deteriorating. We're going to have to go through the root causes. And to do that, we're going to need to actually go back in time kind of and try and reset everything. But it's not going to be easy, obviously. I think it's going to take a lot of time for the fields itself to mature and for doctors and scientists to mature themselves. Because right now, I think most funding and most of the people, most of the academic labs, they're still like shooting for some kind of, they're trying to help everyone that has this disease label that we call Parkinson's. But the label is just a label and it's not a real entity in the world. And I think until we actually get to the point where we can treat people as individuals, we can zoom in on their specific abnormality and really hone in on what's going wrong with them. I don't think we're going to, I think we'll continue to see these failed trials after failed trial. I think we're going to need eventually more programs like the CCBP in Cincinnati, which Roberto's spearheading, where people are actually treated like individuals. And we have these kind of individual treatments. And we have teams of people just working on how do we fix what's going wrong in one person. Because it's, like I said, our brains are very complicated. And each person's going to need that kind of multidisciplinary team of people around them. Your second question was about ethics and DBS. And so that was also another therapy that I obviously had some idea of what DBS was, but I've gotten to know it very, very intimately since then, to say the least. And I wasn't as aware, though, at the time of what adaptive DBS was either. And these new adaptive algorithms that are able to read out these beta waves or read out the brain signals or the LFP data. And they take in that LFP data and they modulate the signals, or they modulate the simulation based on what they're reading. That has been a revelation to me recently. It's what's allowing me, it's giving me my life back. It's allowed me to live again. It's allowed me to travel. It's allowed me to do the things that I love to do with my life. I still have a few problems here and there. There's a few like weird bugs / side effects, but I would take how I feel today or how I felt 2 years ago any day of the week. But there's a lot of ethical concerns that are going to be inevitably cropping up as a result of having DBS. But the biggest ones are how invasive it is. I think it's still a lot to ask most patients to go through. I mean, implanting a battery in your chest, having wires tunnel through your neck up to the cap in your head, it's a lot. And I think until we have better solutions for that, some of the ethical concerns, well, in my opinion, that is big ethical concerns. There's a lot of pain associated with actually going through this procedure. And the pain, I think, at times it felt like it was too much to hoist on other people as well. But I'm here now. Like I said before, I wouldn't change how I feel now for how I felt 2 years ago for anything in the world. So I'm very grateful to my whole team for actually pushing me to go through this and to be there for when I need them to be. But yeah, I hope that answered your question.
That was a great answer. Hearing you be so genuine and authentic about your journey is amazing. And getting to be up close with someone that's, actually had a DBS stimulator, implanted is really neat. And there's a lot of neuroethics involved, which you spoke on a little bit. And Dakota actually has a question kind of touching on this a little bit more. So I'll pass it off to Dakota.
Yeah, so I was kind of wondering what new potential treatments you find most exciting from all your research, and how neuroethics tie into these treatments, which you spoke a little bit about DBS.
So unfortunately, I don't see any great therapies out there. There's nothing that's coming online anytime soon that I think is going to be the one that knocks us out of the park. I think there'll be some things along the way, like some of the synuclein aggregators. Probably go the way of some of the A beta ones as well, where they'll look like successes, but then we'll see over time as they actually get implemented into the real world that they're not they're not the success that we want them to be. I do think though that more as a result of that, more of these invasive therapies will be coming an option for more and more people. Things like DBS will grow exponentially at some point. However, until the surgery becomes much easier for patients to manage and much easier for doctors and the surgical teams as well, because the teams are pretty large. And as a result of all those things, I mean, there's only a few centers in the world that actually do DBS. And so that barrier will need to come down so that more patients like myself can benefit from the therapy, and that more people can actually then, have regain their quality of life to the degree that I have. I've seen a lot of patients that have not, and a lot of that is there's a lot of ethical concerns there as well, because imagine like having to go through. I can't imagine what would happen to me if I had to go through everything that I went through in that surgery, only then to find out that it didn't work for me. That'd be a huge letdown. I have a lot of empathy for a lot of my friends that have gone through this and that have not had it work for them as well as it is for me. So it's something that we need to be very cognizant of going forward, that we don't oversell what we're trying to do here either. Because I think it's very important that people in the field, they need to be scientists, not salesmen. They should not be selling you anything. They should be giving you the cold hard facts about what you're going to go through if you're going to actually go through with DBS. But yeah, I hope that answered your question.
It did. I really love what you said about being scientists, not salesmen. And speaking of the ethical concerns, Camilla had a question about like certain apprehensions with kind of where the field of neuroscience research is going. So I'll pass it off to Camilla.
Yeah, it seems very clear to me just from like reading the Tomorrow edition and everything you've said that you're a person that's very excited about like new technological advancements in the future. I was wondering if there's any particular technology that you've found yourself a little apprehensive about when researching.
Yeah, so there's a lot of things I'm excited about, like the Apple Watch and some of the new things that like Rune Labs can do. But there's a lot of technology as well that is hurting a lot of people out there. Like focus ultra, like the problem is about it's applying the right technology to the right person. Because there's a lot of patients that get very excited to hear that. Like I remember 2 years ago when I was, or 3 years ago when I was thinking about whether I should get DBS or something else. It was a very critical time for me. And those options that I laid out in those 4 cards, I dive into them in the book that I wrote with Dr. Rosano. But they were very real options, and I really considered each one of them. And I knew patients that went down and picked one of the other cards rather than picking DBS. I've seen the outcome that they've had, and it's not good. Like DBS was the clear winner, and it's the one that was clearly the right choice for me as well. The problem is though, even though I tried to do all the research I could, I did not have enough information. In the end, I had to rely on my doctor and my team around me here in Toronto. I can imagine though, if I didn't live here in Toronto, if I had a different team around me that had a different specialty, different area of focus, I probably would have picked something else. If I lived in San Diego, I probably would have picked stem cell therapy. If I lived in Switzerland, I probably would have picked focus ultrasound, for examples. And I've seen all the hurt and the damage that they've done to friends of mine. And so I'm grateful that I live in this one part of the world, but I'm also very cognizant of the fact that like there's a lot of people out there that don't live in a center that has a specialty that might help them. Now there are other diseases as well that like focus ultrasound would be better for. For example, if you have essential tremor, then focus ultrasound looks like a better option for you. But yeah, like to get there, you need like a whole multidisciplinary team around you because you need a trained neurologist, you need physiotherapists, you need speech pathologists. Like I even need a speech pathologist myself. And it's yeah, having that whole team of people around you, unless you have like every part of the team that you need around you in place before you actually make this decision, I'm not sure you should be making it for yourself. Yeah, that's my answer.
You speak of the teams that kind of collaborate within between like the patient and doctor interaction. And that kind of leads to Isaiah's question that talks about the interaction between researchers and like pharmaceutical companies and patients with Parkinson's and like potential disconnect there. So I'll pass it off to Isaiah to learn about that a little bit more.
Yeah, so you mentioned like talking to people all over the world. And as someone who's engaged with all these scientists and researchers, I understand that you find yourself being the only patient in the room. I think you mentioned this on your blog post. And so given that, I was wondering your thoughts on how you think researchers and scientists and these pharmaceutical companies can better involve patients in the development process and just in the conversation in general to ensure that they're actually being heard.
It's very hard because you need to find the right patients for the like whatever therapy that you're actually building up. You need the right patients. You need patients that can be objective as well. No, but we're all like human beings, and we all have our subjective biases, and we're all kind of no matter how aware we are, even myself, no matter how aware we are of whatever it is we think we're going through, we're still just one person who's going through it for themselves. And you're always going to be biased towards your own experiences, no matter who you are, what you're doing in life. Now that said, I think it's still critical though that we find a way to engage patients in the process of actually developing these therapies, because there's an analogy I like to use, but I think it's still very apt. Imagine like you're a company who's designing clothing, but you only have men on your staff, and suddenly you have to make something for women. What do? You hire some women onto your team. You use them, or you work with them to help you build out whatever you're going to build for people like that. I think something similar needs to happen in this field. The problem is that patients, there's so few of us, and we don't have the time. Most of us do not have the time or the energy needed to actually become experts in this field. And you do need to be an expert if you're going to understand everything that goes into this. So it's very hard, and there are no easy answers, but maybe one day there'll be some BCI machine that will enable us to like skip through all of the learning process and just get to the actual solutions. But yeah, I don't have a great answer, to be honest. But thank you for the question.
That's okay. That was a great answer, despite there being tricky to cover a lot of different bases. In terms of Rune's lab specifically, and talking about kind of how they utilize brain data and kind of looking into the future. Santi had a question regarding this, so I'll have her ask that.
I was really pleasantly surprised to hear your story about joining their team, especially with like what I've heard about them before. So I would love to hear about your perspective about their company as a whole, working with neurodata and neurovisualization, especially within your perspective of like patient advocacy.
Yeah, sure. So I don't know if you can see, but I'm actually wearing right now a Rune Labs shirt as well. So I do like have a lot of love for the company and the people behind the products that they're building as well. So I'm biased in that sense, but I think I'm still objective enough to be able to assess what they're doing and give feedback as well. So I talk almost daily to the CEO of the company, and I have like a very good relationship with him. But he's a very kind of rare person himself. His name is Brian Pepin, if for those who don't know. Um, he saw the value in what I'm doing right away, basically. And we worked together for a while. We set up a patient advisory board for the company. And then I brought in patients who I thought had something to contribute. So I brought in doctors and lawyers and engineers and professionals as well that could actually contribute to what the company is doing, but our patients as well. So they have that perspective and they have that voice. They can speak with that kind of authority. And you need people who are very confident in what you're in the message that they have to give to the world as well. So without that confidence, without that ability to try and tell people from experience, from knowledge as well, that you think you know what's best, then yeah, you'll just be walking down a dangerous path. But coming back to Rune Labs, so coming back to the future, I think there's another question about the future of this company and this field and this technology. It's going to continue to get better. So there's going to be some big milestones. Hopefully, you'll see towards the end of next year, though, or some of them might happen in the first quarter of next year as well. But many of them will happen towards the end of next year, where we're going to bring on better symptoms as well. So right now there's just two symptoms, really: tremor and dyskinesia, FDA approval for. Soon we'll have gait and postural instability, and we'll have some speech impairment measures as well. So patients will be able to toggle between them and see how those five really different symptoms have all been managed over the past months and weeks and years, and really get a much better sense of what they've really been feeling and experiencing. Because the two symptoms that we have today, just tremor and dyskinesia, that's only a small segment of the patient population that has those two symptoms as their biggest problems. The fact that as soon as we like roll out that'll be a huge step towards helping out more patients like myself. And then what we're also going to be doing at some point, though, is so we have a huge now machine learning push and machine learning team that's going to enable us to predict patient symptoms as well before they even have them. So in 2 hours, I will have a better sense of what my symptoms will be like at that time, and then I can better manage it by taking medication right now. That might help me then, you know, either stabilize my day a little bit, or just give me that predictive awareness so that I don't go and like get on a bike or do something or go for a drive or do something that might endanger me as well. I'm not sure if that exactly answered your question, but thank you for asking it nonetheless.
That's also a perfect segue into Jake's question, which is regarding kind of like early care treatment, because you're speaking about future progress is going to be able to alleviate certain symptoms, but he's kind of wondering about like an earlier end treatment. So I'll pass that off to Jake.
Yeah, so we've talked a lot about like different therapies and methods for like symptom alleviation, but I was wondering what headway, if any, is being made towards like preventing Parkinson's or diagnosing it earlier. And then also for a more like longer term question, I'm curious to hear if you think there's any prospect of being able to like effectively cure Parkinson's, whether it's in like 10 or 100 years.
So for the last question, I would say pretty confidently that no, we're not going to cure Parkinson's. I think it's going to be with us for as long as humans are alive. And I think, if anything, it's going to continue to grow in the population because there's a lot of other diseases that we are going to have cures for, a lot of heart diseases and lung diseases. We will, I think, have more effective cures for those non-brain disorders. Those are relatively simple organs compared to the brain. I think we'll figure them out before too long. But that means that we'll have a lot more people that live to a much older age, which means a lot more people will inevitably then get diseases like Parkinson's and Alzheimer's, dementia and ALS, and all of the other like terrible things that might happen to a person's brain as they age. I don't see anything coming along that will stop that progression or even that inevitability anytime soon. I hope I'm wrong though. I mean, I hope that one of these nuclein disaggregators or beta or tau disaggregators, maybe I'm wrong, and maybe that will be the thing that really does push us forward, but I don't see it as a very likely possibility, to be honest, unfortunately.
Thank you for that. Kind of moving off of looking at like future directions, we wanted to speak a little bit to you as a patient advocate and a bit more about the behind the scenes of this. So Kat has a question regarding this.
Sorry, my connection's a little rocky. My question is if you've noticed a difference between the public emphasis that companies put on helping patients with like real problems versus the approach they take behind the scenes. Like, and are there any sort of specific players, like whether researchers, executives, or others that you find are particularly interested in or dismissive of the patient experience?
So everyone kind of pays lip service to patient experience, but not a lot of people really take it very seriously. Right now, people don't really get what the patient experience is like. I mean, you can study Parkinson's all your life. I know I have a ton of friends who have Parkinson's. A few of them, they were scientists and doctors in their previous lives. But the story is the same thing like every time. Not only could most of them not identify the early symptoms of this disease in themselves, but they needed somebody else to diagnose them. They couldn't diagnose themselves. I haven't met anybody yet that's actually been able to diagnose themselves with this disease. So that tells me a lot about how this disease progresses and how this disease unfolds. But coming back to Jake's point, also tells me how kind of screwed we are as a society. If even like the people who claim to know this disease best, they don't really know what they're talking about. If even they don't have as good of an understanding as they need to diagnose themselves and to be objective about themselves, then what hope do the rest of us have? Now that's kind of a negative point. I don't want to just leave you at that, but it's a reality that a lot of patients like myself have to like kind of confront and deal with. There's another part of your question I forgot what the first part of the question was. What was that first part again?
Oh, it was that, or I think you sort of answered the first part, but I guess the second part where sort of I was wondering if, because you work with like different types, like both sort of scientists, it sounds like it was the kind of more senior executive decision-making people at the companies. I was wondering if you found like either the scientists or maybe the executives like particularly like interested in or dismissive of it. Like who do you find is like sort of most willing to listen or most curious about your experience versus who's sort of like, you know, actually we just care about our bottom line?
So I think I've been pretty fortunate to meet a lot of like pretty like, good people along the way. People I think are genuinely trying to help people like myself. I think that most people like they enter into this field with the best of intentions, and those intentions carry them forward, but they're limited by the fact that they're working at a giant pharma company or giant office building somewhere, and they have to answer to a boss, and the boss then supersedes anything that like the demands of their bosses then supersede the demands of patients that they might have been trying to help originally. Even like I know a lot of like scientists and doctors who have family members that have Parkinson's or Alzheimer's or dementia or something of that sort, and they got into this field because they wanted to help them. But today they're working in the back of some giant pharma company on some mouse, trying to make the mouse, trying to cure like mice again. And that's just kind of the pressures of society and pressures of of the pharma world as well. You can't blame them though, because like at the end we're all just doing what we can with the time and the resources that we have. But I do wish that more of them would listen. I wish, coming back to somebody's question, but I wish more patients actually ran these kinds of organizations and these companies, and I wish there were more patients that were spearheading some of these giant pharma companies, even because like there are some patients that are in those roles, like the Silverstein Foundation. I'm not sure if anybody's aware of them, but Jonathan Silverstein, he's a patient himself, and I think that they've been able to do more good in the short time that they've been around than some of the larger patient organizations. But also, I mean, there's some very well-known patient organizations that themselves have kind of lost their way because they well they didn't really care about the science or the research. They just they hired some researchers, some scientists, and they let them figure out all the research and science stuff. But I don't think we can just shove off that much information to people who, I think you need to be daily living and have a vested interest in this if you're going to actually make progress in how people live. Because I think the goal of most pharma companies should be to try and not to cure this disease. I don't think that's possible, but try and help people live a little better tomorrow than they can today. I think if that was the goal of this whole umbrella that we call this whole Parkinson's field, I think a lot more patients would be living better tomorrow than they are today. But unfortunately, that's just not the case right now. But hopefully in the future that will change. And I have seen some things that indicate that there are things changing in that direction. TBS is a great example of that. But there's still so few people, patients that actually benefit from these kinds of therapies. But yeah, that's the world that we're just gonna have to figure out a way through.
Can I ask you sort of a follow-up question about something you said that I found was really
Yeah,
interesting?
sure.
Do you feel like if, a lot of the work that's currently taking place in pharma companies, with scientists beholden to their boss and then what the pharma executive wants, et cetera, and you mentioned they're just sort of working on these mice models, regardless of what they might think is best sort of to help patients. Do you feel like if that work was taking place, that research was being done outside of the pharma context, with more neutral money, and with easier collaboration between scientists and patients and less of the sort of executive bottom line, that it would go farther? Or do you think that there's elements of it beyond their money that makes it sort of necessary for this stuff to be concentrated in pharma, if that makes sense?
Yeah, it does. I think that something that's holding them back is the fact that, as Jake was saying before, that they're all searching for the cure. I think if they were just worried about trying to, because there are about 50 different symptoms of Parkinson's, I kind of wish they would just divide up this disease and try and knock off one symptom at a time. Because if my symptoms were all gone, then I wouldn't really have this disease anymore. And so there's a whole mess of a convoluted space of disentangling the symptoms from the disease that I don't think anyone's been able to do properly yet. Even Alberto, I mean, I've had some conversations with him about this and some heated debates at times about symptoms versus disease. And I just don't think he really he's a great guy and I love him to death, but I don't think he really gets what it's like to live with something like this, day in and day out. Every moment of the day is just Parkinson's, Parkinson's, Parkinson's. You can't escape it either. There's nothing that I can do to shut it off. He can go home at night and he can actually get a step away from this disease. I can't. And so it's always on my mind. It's always on the minds of patients all around the world. And yeah. So symptoms versus disease, I think it's a false dichotomy that the society's created. I don't think anyone can tell me where the symptoms begin and the disease ends, or the disease ends and the symptoms begin. There's no point at which anyone can point out and say that's where that symptom is coming from. I think if we could actually reorient society so that we can just try and focus on individual symptoms at a time, then we'd be better off. But that's a long way away from happening right now.
I see. So you think the sort of search for underlying causes is taking the focus away from maybe where it should be?
Yeah, I do.
Thank you.
Thank you for the question.
Yeah, thank you for touching on that. And just moving backwards a little bit from the sense of talking about the intersection of labs and researchers with patients. We have one last question from someone that's not here, Nicole, who's asking about the collaboration between academic and corporate environments. So I guess from academic to lab settings. What do you think is the most crucial aspect to enhance the collaboration between these two sectors in order to get further in the industry?
You mean for scientists or for or like advanced therapies? Like, is it people in
for-
the in there that are
like
pursuing-
for advanced therapies in neurodegenerative research?
I mean, I would love it if some of these companies were like decentralized entities that didn't have bosses, but I don't see that happening anytime soon. So I don't know, in terms of like actually like rearranging the structure of these companies so that they're more in line with the needs of patients. One way might be to put patients at the helm of one of them someday. Like make a patient the CEO of like a big pharma company. I think that would be a big monumental step towards actually helping us. But then it's about like finding the right patient as well. 'Cause you don't just want somebody who's just going to be selfish and just try worry about themselves. You need somebody who's going to be up there and selfless and can step out of their own skin as well and get into try and empathize with other people. You have to be able to live through see things through their eyes as well.
That's a great answer. I'll pass it off to Mia here, but on behalf of all of us, thank you for answering all of our questions. It's been amazing hearing from you directly as someone that's, right in the middle of it. And I actually have a family member with Parkinson's. And so being able to see the treatment on like working within your life and how it's benefited you is really cool to see. So thank you so much.
My pleasure. If I could just like put out one last word, it would be to that feel free to use me if I can help you guys in any way. If there's some researcher that you want to get in contact with, I'm happy to try and open whatever doors I can to them. I'm really just trying to be a bridge between researchers and patients and doctors in this whole mess of a field. So if this is something I can do to help you guys, just reach out and let me know.
Yeah, thank you so much. I think we're all so grateful to hear, especially that, because we're in the stage right now and we're trying to make as many connections as possible. And it's great to hear from someone who's on the patient side. A lot of the interns have said that they're really interested in that and improving outcomes through the patient, making it more individual. So it's great to actually hear from someone who's impacted by the things that we're studying. And this is our first guest mentor, I think, that has been able to really show us what the individual's life is like in any of these diseases. So thank you so much. I will share the recording with you. And yeah, that was a great conversation.
Thank you for having me. Bye. Take
Thank
care.
you.